ask everyone to switch cameras on now so we can smile and wave to each other.
Smile and wave.
That's a good idea, Emily, so that our connection will be wonderful.
It's nice to all see each other, and I know lots of people.
Hello, Lydia. Namaste, Lydia.
Hi.
Oh, nice to see you.
Hello.
How are you?
Oh, so great to see you. Hi,
wow, so nice.
Morning, everyone.
Namaste, Peter.
It's very early for some of you. It's late for some of you in Nepal, so thank you so much for staying up. And it's very early for some of you, particularly on the West Coast. So good morning, and thank you so much for joining us so early. So we might just wait another sort of minute or so. I'll just run through a little bit of our usual Zoom housekeeping. I know quite a few of you have joined the last couple of calls, so this won't be anything new to you here. We are going to, once we get started, ask if, as lovely as it is to see everybody, we're going to ask if people don't mind switching their videos off once we get started. Because it helps to speed up. We find that we have a faster connection if we have less videos on. We'll also have everybody muted except for the speaker. So you will be muted, but there is a chat function. If you have a look at the bottom of your Zoom screen, you should be able to see a little chat icon. If you click on that, you can post any question or comment at any time through chat. Please do send your questions through. I know many of you are going to have questions for Jamuna and for Rudra while they're presenting, so please just send those questions through. We'll try to make sure there's plenty of time to answer those all. If you have any issues with the Zoom technology through the call, then Travis is your go-to person on that. He's our resident Zoom expert. So if you can try to reach out to Travis and he'll see what he can do to help you if you have any problems. I think that's about it. So I think we can probably get started. For those of you, I think I know everybody on the call, but if there's anyone I don't know, I'm Emily Bild. I'm the Director of Programs at GoPhilanthropic Foundation. I just want to, give a very warm welcome to everybody today. I know this is earlier than our last couple of calls, and it's great to have people join, and it's so lovely. We know what a busy time this is for everybody. This continues to be an extremely challenging time for everyone across the world, and so we just feel very very grateful that everybody takes the time out of their day to join when you have so much going on in your lives. This is our third ever virtual hub meeting. So we did the first one about a month ago in Guatemala, and then we had another meeting a couple of weeks ago in India. Both times we had amazing partners from those countries that we brought in to join the calls. The idea is that we want to give all of the GoPhil community an opportunity to hear directly from our partners firsthand. The idea is to kind of bring people together so that we can all listen and learn to what's happening on the ground. It's so much more meaningful when you can hear directly from our partner organizations about what's happening, the challenges they're facing, the work that they're doing, and it just is we think it's a more effective way to keep you updated than to keep bombarding you with updates, especially because things are changing on a daily and weekly basis in most of these countries. But also, most importantly, we want to give our whole GoPhil community space to ask questions. This is really important that you have the space to ask the questions you would like from our partners, rather than just hearing the information that we're sending, and the opportunity to hear directly from people kind of working on the front line of response efforts. I think I've already got a message from Rudra to say that he's lost his connection. So let's just see if we can try to get him. Let's just see if we can try and get him to get back in. This is going to be a bit of a challenge, I think, today, because I think due to like weather conditions in Nepal, they're having, I know Jamuna's had some problems already. So, okay, he's coming back in now. So
maybe we have to switch off video, Emily, so that I think connection will be better.
let's see if we can manage. Is he back in now? Rudra, can you hear us?
Yeah, sorry.
Okay, great. All right, welcome back. So today we have Rudra Neupane from a program manager from Phase Nepal, one of our partners there, working primarily on health, but also on education and community development and livelihoods. And we also have Jamuna Shrestha from the Director of Child Rescue Nepal. So welcome to both of you. We also have Gerda, I think, on the line, who also works with Phase Nepal. So hopefully we'll have an opportunity as well to say hi to her later on. Most of you are very familiar with GoPhil already, so I don't want to give a long introduction to what we do. And I want to make sure that we have plenty of time to hear from Rudra and Jamuna. But for those of you that we are meeting for the first time today, we are a foundation partnering with grassroots organizations working on human rights, health and education across 7 countries. Community philanthropy is very important to us. Like we've always, you know, since we started almost 10 years ago, we've always had the philosophy that it should be local solutions to challenges, and that communities and community leaders know best how to tackle challenges in their community. And I think this is never more relevant than now in the time of this crisis. You know, this is a global pandemic, obviously, that we're facing, but the impacts to COVID-19 are so different in every country and even within countries at a community level. So, you know, in this point, our partners who are working very much at the local level really have turned into emergency responders. They've turned into the first responders in their communities. And they're having to provide support that they wouldn't normally be doing. They're often having to do things that are outside of their regular programs. Like we've got partners across all of our countries who are now providing things like food relief and medical aid, buying soap and other hygiene products for the most vulnerable families in their communities, which is a huge, huge challenge for them. Most of our partners are very small organizations, and they don't carry they don't keep cash reserves for this kind of crisis, which was of course totally unexpected. And this is where GoPhil comes in, because what we do is support our partners as best we can in whatever way they need supporting. So from the outset of this crisis, we responded by setting up a rapid response fund to try and raise funds that we could send across quickly to help them provide life-saving needs in their communities. We weren't really sure when we set up this fund how much we would manage to raise, because we know that this has of course impacted everybody, and everyone is struggling right now. But this week we have just crossed the $100,000 mark for our rapid response fund, which is way, way beyond more than we ever thought we would raise, and many of you on this call today have given very generously, so we're hugely grateful to that, and really quite moved, because we know that this is such a difficult time for everyone. So we'll talk a little bit later about the response fund, but I wanted to hand you over right now to Rudra from Phase Nepal to talk to you more about the impact that this crisis has had in Nepal, and in particular on Phase's work. So Rudra, thank you very much for joining us today. I'll hand over to you.
Yeah, thank you, Emily, and namaste and good morning, everybody. I'm Rudra from Nepal. First of all, I would like to thank Emily and GoPhil and the GoPhil supporters for supporting us at this very difficult time. Basically, this is a very difficult time for everyone across the globe, and the crisis is so huge and resources are so scarce. If we talk about Phase Nepal, Emily has already said that we have been working in the area of health, basically primary health, education, and to restore livelihoods of the people. And also After the 2015 earthquake, we have been working in the reconstruction sector, basically for the poor and marginalized people. And recently we have focused, since last 2 years, we are focusing our activities to the people with disability as well. So we are a little bit in that, more in that direction as well. So if we talk about the current crisis, we had the first COVID case registered in Nepal on 20, providing health services there. That is one. And the impact in the community, and some other projects of Phase Nepal are closed, and people are working from home, like the reconstruction works and the other livelihood projects. People are working from home, but the health staff are in the community and they're serving the people at this time as well. And regarding the impact, we all know that everyone is impacted, but the impact, form of impact is different for different people. And we realized that the impact was very worse to the people with disability, and basically within the group of people with disability, severe and profound category were the worst affected. They couldn't buy their medical supplies like urine bags, catheters, and all that, diapers and all that, because they were not allowed to move to the drug stores, and their food supply was also getting very, very low. In the usual times also, they were not very well off. They could not prepare themselves, get prepared for the crisis. They could not put stock, so that they were affected, and they asked us for help, and we approached to GoPhil and others as well. And yeah, with this support, and in the last week, April 17 and 18, we provided food and medical supplies to almost 52 people living with different forms of disabilities in Kathmandu. And later, the last week also, we had a small distribution again, and then we covered some 25, 26 people with similar conditions, and these are the people with disability. Basically provided the basic foods like rice, lentils, cooking oil, sugar, and then salt. It was included there, and also to keep hygiene and sanitation, we provided soap, washing soap, and bathing soap. And depending on the type of vulnerability or the severity of the disability, we also provided some other supplies like diapers, catheters, and urine bags to those who need them, because all of them didn't need those things. And yeah, all these things were done in coordination with the local government, because to avoid duplication of the resources. Yeah.
Thank you, Rudra. I just wanted to ask if what kind of support has been, you mentioned there that it's been done in coordination with the government, like what kind of support has there been from the government in Nepal? And also bearing in mind that I know Phase works in probably some of the most remote parts of the country. Is there any kind of action plan if COVID-19 does hit these very remote rural villages that I know are very long way from health facilities? So I wondered what the government has been doing on that.
Yeah. Basically, government has also announced a relief package, and they are also distributing. That include, but I don't have very exact information on that one. But most of the people said that the quantity is very low. Like they said, they got 5 kg of rice, and 1 liter or half liter of the cooking oil, and 1 kg of salt, and 1 kg of lentil. and which is sufficient for about a week only, and that is that's what I got, and from the most of the people about that one. And also the other thing is that the relief distribution was not very well organized at the beginning. Now it's getting streamlined, and government is targeting to the people with different sort of vulnerability. They have now the data, but at the beginning it was not. And the people with disability could not go to the distribution points and collect those things at the beginning. But now the government has a little bit targeting, and they have collected all the the information. And related to our action plan and other things in the remote areas, we don't have such very action plan kind of things, but we have a plan to continue our health facilities there. We are working there, and also we are supplying this personal protective equipments for our health workers, and also trying to cover some of the communities around our health facilities. Like we provided at least these are not very good one, but at least homemade kind of masks to protect themselves, and we have the help desks, and they provide awareness kind of things. And also in some of the communities, our team has worked with the government to set up quarantine spot, quarantine facilities for the people who are coming from outside of the community. These are the things we are doing, but and now gradually with the increase of cases, basically in the Far West, we are now in need of additional supply of PPEs to our staff. Last time we provided almost 10-20 sets of those things, but these will be used once they have the cases. So we are now planning to process and deliver those things to our staff. And our focus basically will be to continue our services through our staff first, and later on, based on availability of resources and the need, we will develop the package for supporting the people around there. Though we are working in the remote areas, but the last support was basically in the Kathmandu Valley, and people here also got affected, and those people with disability are worst hit by this crisis.
Mm-hmm. We have a question from Travis around, because you were mentioning delivering PPE to your staff in the rural areas. How challenging is delivering this PPE given the current travel restrictions?
Yeah, this is very not very difficult. We can, but transportation is of course difficult. We took our own vehicle up to the Far West, and from there we delivered transported manually. That's the only thing we can do now. So it's a little bit costly. Otherwise, it's possible.
Mm-hmm.
Just the matter of cost.
And I think I remember Gerda saying that just before the lockdown happened, you were also able to get quite a lot of PPE and hygiene products into these areas because you were able to predict that the lockdown was going to come.
Yeah, little bit of those things. We delivered one lot to all the project areas just before the lockdown came into effect. Yeah.
Great, thank you. Given that we've got Gerda on, I'm not sure how good your connection is, Gerda, but because I know you're over in Pokhara, did you want to just introduce yourself quickly and say hi? Sorry, I put you on the spot a little bit.
No, that's fine. It's nice to talk to everyone. Nice to see you as well. So I'm not actually sitting in front of the mountains. I've just put a background picture because it looks nicer.
I was like, it's not very dark there for you.
No, it's dark outside. Yeah, just I'm Gerda. I'm actually a GP used to work in South Yorkshire in England for 10 years, but for the last, now coming up to 10 years, I've been based back in Nepal, working for 2 different organizations in the health sector as well, but I've been involved with FACE since the very start and have been to all the project areas in the past. Rudra just said that we took our own vehicle to the project area in the far west. He sort of didn't mention that that takes about 3 days driving.
3 days one. Yeah.
Sorry?
3 days one way.
Yeah. Because it's just the roads are so bad and it's quite a long distance from Kathmandu. But what I might also add to what he said is that at the moment, Nepal has only 80 cases of confirmed cases, 82 confirmed cases of COVID, which are almost all in the southern districts near the Indian border. But the lockdown, of course, makes a lot of sense to stop those from getting into the hill areas, into the remote villages. But of course, then the lockdown has affected people who would otherwise be traveling for work and for healthcare, etc. And our staff who've been basically out in those communities have seen an influx of young men who used to work as laborers in India and who found their way back to their original villages. And that's, of course, made everyone very nervous about them bringing COVID with them. And but in the last in the last 6 weeks during the lockdown, FACE health workers have delivered over 40 babies and arranged evacuations for 3 mothers who were in severe difficulties during childbirth, and several other serious cases like burns and accidents. So the fact that they're still in the communities is actually, as always, but especially during this time, really saving lives as well.
Amazing. No, I mean, I remember it's such a huge relief that so far the cases look very under control in Nepal, and obviously keeping everything crossed that it stays that well. It must have been, as a health organization, it must have been absolutely terrifying for FACE to kind of watch this playing out, because you do absolutely incredible things in the communities where you work. And Peter, who's also on the call, and I have been fortunate enough to meet some of your health workers and see some of the work they do, and it's really incredible. But it's obviously it's a million miles away from like ICU and from ventilators and all those kind of equipments that we've relied on in the West to keep people alive with severe COVID-19 cases. So it must have been, I can't imagine how terrifying it must have been for you to worry about this pandemic hitting those communities, and knowing that it just wouldn't be possible to get those people to ICU, to beds and ventilators. So yeah, so it's really incredible. What you do is really amazing, and always kind of astounds us. But I think even more so, like your calm and your strength through this crisis and has been really, really admirable. And we're really sort of, we're very privileged to partner with you.
One of the things that's been really worrying is that, all the countries that have had a lot of cases of COVID, they've seen that children seem to do well, but we don't know how children with severe malnutrition do if they get infected with COVID. And in the areas where FACE works in the far west, about 50% of children are malnourished, of those under 5 years. So I was so worried if this infection hits those villages, whether they'll actually see children getting really sick. Because nobody knows.
There's so many unknowns. Yeah, exactly. And the same with respiratory issues as well. Like what some of our partners in Guatemala have been seeing is that, it's a very different impact when it hits communities that already have respiratory problems from cooking methods and from exposure to pollution and these kind of issues. So there are so many unknowns in it, and it is very frightening. So. Well, thank you so much to both of you. We'll have some more time for some questions at the end, but we'll just kind of move on now to Jamuna at Child Rescue Nepal, who I'm just checking is still on.
Yes, I'm on.
Great. Jamuna is the director at Child Rescue Nepal, based in Kathmandu. We've been partnered with Child Rescue Nepal for a few years now, supporting their work around rescuing and rehabilitating children who have been trafficked. In fact, even though trafficking is quite high in Nepal, they're one of the few organizations that are doing rescue work, and their team are extremely brave, going into all kinds of situations, factories, restaurants, brick kilns, in partnership with local government and police, and rescuing children and then supporting them, and where possible returning them to their families, and providing ongoing support. So Jamuna, if you would just like to talk to us about how this crisis has impacted you and your work there, that would be great.
Yeah, thank you, Emily. It was a wonderful introduction. Thank you so much. I will give you some brief update of our organization, because Faze and then other friends have already given very good summary of our country. And yes, let me on my video so that everybody can see me. Namaste, this is Jamuna again, and I'm country director for Child Rescue Nepal. I think you, all of you know already how we are working, and Emily has given very good summary for our organization. So I will give you a brief update from our side. Let me start from one short story of our children, so that you all understand that why we are working with the children in our country. So since since January till March, before the lockdown, let's say, we have done 11 boys rescued from different places. As Emily has already mentioned, that we do rescue from different places, like hotels, restaurants, brick lane, and then factories where the children are locked. And we do not say, our government doesn't like to, use word slavery, but definitely if you see the situation of children, then their situation definitely is like a slave. So we really want to take out those children from that kind of situation. So I really wanted to give one story of one youngest boy that we have rescued recently. So he is 12 years old, and then he's really from poor family background. He's from Makwanpur district, where we used to work do a lot of activities, sorry. And actually he was lured by the neighbor uncle, and then he came because of seeing his poverty situation. That neighbor actually lured him very badly, and then he came to Kathmandu. Actually he trafficked, let's say, to Kathmandu, and he worked at the age of 12 in a carpet factory. And it was so terrified situation when he was there. And then, he worked there for 2 months. And then again, other person shifted him to a hotel. So we rescued him from the small itinerary shop on 16 February 2020. So he used to work from 5 in the morning till 8 in the evening. And then he was actually promised to provide 4,000, I think that is 40 or maybe 29 pounds, something like that, per month. But he never actually received a single penny while he was there. And then situation was very worst when we did rescue of him, and he actually had to clean table, floor and wash dishes, plates, and bring a lot of waters from well and tabs, and he had to work long and without having very good support from his owner. So in that situation, we actually rescued 12 years boy, and the situation is not that much good. And when we rescued, we actually brought him into our transit home, where he actually received very good food, very good support, counseling, everything. And he realized that, okay, I do have also this kind of better life. So that has been possible because of GoPhil's support. Thank you once again, GoPhil donors, Emily, all the people who really providing support to us to run our safe home. so that so many children are safe, and then they are really getting back their childhood. So having said that, we really want to do a lot of rescue, you know already, and then this COVID actually has increases a lot of situations in our country. Even our friends said that we have only 82 cases, but the lockdown, actually, the cases is not that much alarming as Europe and America, but our situation, bad situation is lockdown. Lockdown actually created a lot of problem in our country because we are actually depend on, you know, country like India to get food and other supports as well. And then you have, I think you have already heard about closing border, because we are 100, I think we have more than 140 borders to India and China, and those are closed at the moment. And now all our communities, our peoples are actually suffering from food, for food. And so we are also getting a lot of requests from the community where we work, because you already know that we work in very remote area of our country. The one district is Makwanpur, and there are many marginalized and then poor community, and now and they are daily wages community as well, and so they are not getting any job at the moment, and they are really suffering. And so they are every day, nearly every day, we get call from community that can you please help, because they know that Child Rescue Nepal is also working in their community, and so they are also, I mean, asking help for food and hygiene kits and, you know, waters support. So those are the things. So we are also thinking how we can help those people in this crisis. I mean, you know, if we can, I mean, at least provide food, then, you know, till the normal situation, they can get job or something like that. This is how the, I mean, brief summary of the community. But of course, the rescue is our prime concern. You know that, and this COVID will definitely, increase the situation in our country, because there will not be job in the community and then their family. And you already know that even in the normal situation, how many children were trafficked to city to get job. You know, so after this COVID, there will be disaster situation, I would say, in our country. So our government is also, I mean, thinking that how they can bring a very good package for labor, and then, you know, people who do not have a regular job or permanent job. So we really have to think also as a organization who work for the children. So, and then whoever is actually rescued so far, so they are actually from the poor community, and their parents, I think there will be more trafficking, pretty much sure, because there will be many people go in the village and then lure children or their family to provide job or something like that, because you know that all the factories and hotels are closed at the moment, and when the normal situation comes there, you know, the people will definitely need cheaper, you know, labor. And so that is children, you know that in our country. So they do not need to pay a lot of money to have a children to work in their factories or, you know, restaurants or something like that. So the situation will be definitely alarming in our country after COVID as well, because we have been discussing in our child protection working group in different level. One is in International Organization Association, you know that, Association of International Organization, they have a separate child protection group where we are also, I mean, discussing that how we can protect children and then ensure their development and then protections, definitely. And then there is another child protection working group led by the UNICEF, and so we are also a member of that. We are putting a lot of concern on that, how we can save children, how we can provide, you know, security for those children and their families. Those are the things. And we meet in 2 weeks and discuss about children and their families, their protection, all those things, and then they relay this information to the government so that government can also act. So these are the things going on in our country in terms of children's protections, and then and then we are also active member of that child protection cluster. So at the moment, let me give update about our organization program. In our transit home at the moment, we have 6 children recently rescued, that is from January to March. So 6 children are in our transit home. So they are at the moment with us, and they are doing indoor activities, and they are getting kind of support from our house parent. We also are connected because during lockdown there will be mental health problem, or they might think different things because they might have a different feelings because they are very young. And so to minimize this kind of problem, also we provide kind of counseling, we do indoor activities, we do entertainment things so that children will be engaged, and then we can keep them safe and then healthy. So we are doing this kind of things. And but as I have already mentioned you that there are a lot of demand from the community. So we are now thinking that how we can help those community in where we are working at the moment. So biggest demand is food, because they are, I have already mentioned that they are daily basis families. So we definitely need support on food. And then, hygiene kits, because there are many young girls, adolescents who are really, need sanitation stuff, because their health is also very much important. And we are also thinking to provide them hygiene kit support so that, they will be protected from reproductive health problem as well, because during lockdown there might be a lot of issue related to reproductive health and then mental health and stuff like that. And then definitely if we can manage fund and support from every donors and every supporter from everywhere in the world. We definitely want to support water tank so that we can also help government to minimize COVID situation. So that water tank will be installed in public places where the many people will gather, and then so they might be benefiting from that as well. And and then yes, and there is one very crucial part. I'm going to wrap up my update. So one very crucial issue I really wanted to discuss, because during cluster meeting there was a kind of discussion that there are so many children from the age of 13 to 18 working in entertainment sector, even though entertainment sectors are closed at the moment, but 150 children, our one of the friends from the organization reported that 150 children below 18s are working still in the entertainment sector, but they don't have identity. They don't have citizenship. Because of that reason, even they are not getting support from the government, and so they are now struggling to get food. So, and then we are now discussing that how we can help those children as well. And then during emergency, there might be kind of rescue needed. And so our team is all the time ready. So we might also doing rescue, even though situation is not that easy for us, but we Child Rescue Nepal is ready to do rescue for those children to get out from that kind of hazardous situation. So we might be discussing later on. There might be a lot of questions after that. So I might be, I will definitely answer if there is some question, but the situation is not that much easy, even though the COVID situation, COVID cases are not that much high in our country. So so at the end, I just wanted to tell that we really want to connect with the peoples, and the family of our children, to provide food at least, and then save their life. So how we can do that, we can discuss later on. Thank you very much.
Thank you very much, Jamuna. I think that was a great overview. We have a question that's come in from Elena Bruce around, they were asking how prevalent sex trafficking is and trafficking into the sex industry in Nepal. You just touched actually upon the entertainment sector there. Did you want to explain a little bit about the entertainment sector and the bars and the girls that you rescue from those situations?
Yeah, so because we do, we also do have one partner who wanted to rescue of girls from entertainment sectors. There are many girls under 15 age, and so there are there are really high number at the moment. Those girls are really coming from remote area, and so they actually were lured by saying that okay, you'll get educations and good job, but they ended up in entertainment sector. So there are very high number in our country as well, but there is no any legal provision to have a sex industry or something in our country. That all are illegal, and people do illegally. And yes, so there might be a lot of even in this situation. So because as I have already said, that 150 children are still there and they are also asking help for everyone. And so, and that organization also asking for food support. So we might also need to support in this to come. Let's see what will happen. And then there is another question. So safe home, GoPhil support hours, safe house for boy.
I was just going to.
Okay. So, yeah. So we have a only boy. Yeah.
Sorry, I just wanted to introduce. So Joe is the chief executive of Child Rescue Nepal, based here in London with me. So I just wanted to thanks so much, Joe, for joining. It would just be great if you could just say a quick hello and introduce yourself. That would be great.
Yep, I'd love to. Hi everybody. My name's Joe. I'm the chief executive of Child Rescue Nepal, and I run the organisation with Jamuna. We work very closely together. And yeah, it's a very, very challenging time, and it's changing all the time in terms of how we can respond. And Jamuna and I are in daily contact really about what to do. So I guess to summarise, the first thing is that we have these newly rescued boys supported by GoPhil who still need support. We're still, they're out of school obviously because they've just been rescued, but in terms of informal education and supporting them at home, that's still a real need. Secondly, we know that after times like the earthquake, that actually when families have got pressure on them economically, children suffer, and that we're very likely to see an increase in trafficking cases. And so we really need to be ready to respond. And then thirdly, we're hearing of families who really are running out of food, and it's really kind of emergency response in terms of just getting rice, lentils, soap, oil, salt, whatever's needed to them as well. And those needs are coming in every day. So there is a lot that needs to be done, and we are trying to, get to the people who need it the most. So in a kind of constantly changing situation, but we're grateful for your support. So thank you. And of course, both of us can take any questions.
Great. Thank you so much. So yeah, if anyone has any questions for Child Rescue Nepal or for Phase Nepal, please do send them across. Yeah, I mean, I think what's really striking in Nepal is that the cases are relatively low, but it's obviously the economic impact that the lockdown is having.
Yes.
And I mean, I was thinking earlier today, because we had a call with our Cambodia partners, and they're talking there a lot about the impact of tourism, the tourist industry. And it must be exactly the same for Kathmandu, and even for many of the areas where people go trekking, because tourist numbers are right down and are probably not expected to go up again this year. So are you seeing has there been a lot of conversation in Nepal about what's going to happen in terms of the tourist industry moving forward?
Actually, our government is thinking today also there was a high-level meeting about how they can make a little bit, easy lockdown. But seeing the case today, because there was in Midwestern region, today we have 7 cases identified. So because of that reason, government is in really illusion that whether to open or ease little bit lockdown or not. So the tourism sector, I think our government will not really ready for that. The one big concern is that how the industries and then agricultures can start so that we can grow a little bit and then we can do some economic activities. So that is the discussion at the moment. And this is not only for the laborers and others, for us as well, it will be really difficult because even for us to get food after 6 months will be disaster in Kathmandu. So there is no, I mean, the government says that we have a store for 6 months, but yeah, everybody is now keeping, even, you know, some people are keeping some foods and then selling in high cost. So this might also be another chance for us. Yeah. And that is also hamper for our care home because we have to stock some food for our children, and then the cost is going, you know, higher and higher. So even government is saying that you cannot sell in a high cost, but people are going on, nobody is there to monitor. So a lot of challenges is coming in our country.
And you also work in a lot of, because you also do a lot of work on the prevention side of things, particularly in Makwanpur district and quite a few schools, I think, around there. Is there any word yet on when these schools will reopen? And have you managed to stay in touch with the students there during this time to see how they're doing and their families are doing?
A very good question, Emily. So at the moment, our prevention work has been paused because of school closed. And then it seems that even though there is kind of ease lockdown, but the school will not open because government says that, because our testings is not that much going well in our country, so we don't know what will be the situation in our country. Yeah, but our team in Hedera are regular contact with school management and their, you know, community, so that we can get kind of info. Because of that reason, we came to know that they need food, they need hygiene support and something like that. So we are really in touch with them regularly to get their update. Yeah.
Mm-hmm. Great. Well, thank you very much. I don't think we've got any more questions right now, so I just wanted to see, like, if anyone had any last words. Gerda or Rudra, is there anything that you would like to say before we start to wrap up, or do you feel like you've covered everything from Faye's side?
You can't ask two people simultaneously. We'll never know who should respond.
I'm sorry, Gerda, do you want to start with you? Is there anything that you would like to add at all?
Yeah. I just wanted to say that you know, when we were talking about 3 weeks ago about the fact that these people with severe disabilities that we've been in touch with in Kathmandu through our partner, the Independent Living Center, that they're all running out of food and they can't access health supplies. We were sort of scrabbling around thinking, where do we actually fund this additional activity, which isn't in any of Faye's project budgets. And the fact that GoPhil actually emailed at that time, exactly at that time, to say we're looking at getting an emergency response fund, and do you have any projects? It was just so perfect timing, and I just want to say, you know, it's amazing that you and your donors have come to this point and helped when actually everybody's country seems to be currently struggling worse than Nepal in some ways. So I just want to say thank you.
Oh, well, I mean, I think we've been hugely, we've been hugely moved as a team by the response of our donors. We know that, you know, this is a time where, you know, everyone is struggling, and UK and US have obviously been very badly hit. And a lot of people are very focused on providing support and emergency relief at the local community level. But I think what's really special about GoPhil is that, you know, being part of GoPhil makes people feel part of a global community, and I think we all feel very connected. We see huge loyalty from our donors and our supporters to our partners. Many of them have been kind of supporting our partners for so many years, and so it's been really lovely to see how everyone's really kind of come together and supporting organisations across the world, like through this crisis, and not just at the local level. which is great to see. We have a question here from Shirin, saying that she is a civil engineer by profession in Kathmandu, and can volunteer if there's any need for assistance. So maybe I'll leave it to Rudra. Did you want to answer that and maybe follow up with her at the end of the call?
Oh, great to have civil engineer. Actually, we are trying to start one housing project immediately the lockdown gets over. Probably we can talk later on with the details. If you see, and I cannot.
I can ask Travis, maybe you can pass on Shirin's email contacts to both Jamuna and Rudra, and they can kind of follow up. But yeah, thank you very much. That's really kind to have this offer. Jamuna, is there anything that you, Rudra, is there anything that you wanted to add from Faze?
Yeah, I think I tried to cover. Yes, basically very, very great. Thank you. And it was a great pleasure to bring those items to the people with severe and profound disability, because they didn't have got this much of, I mean, this is not a huge support. This will be finished over a month or slightly more than that for few families. But at this difficult time, they got the needed support, and I could see a little bit of happiness on their face because I was personally there in the distribution. So on behalf of those people, I would like to pass thank you to everyone who supported, generated this money and gave us. Yeah.
Right. We're very glad to be able to help. I mean, you're both doing such incredible work as organizations there on the ground, and whatever we can do to support you, you know, we will certainly kind of do our best to stand by you. Well, thank you very much to it's a huge thank you to Rudra and Jamuna and Joe and Gerda for joining today, especially given that it's quite late your time and you've already finished your work day long ago in Nepal. We know how busy you are, so we feel really grateful that you've taken the time to speak to us today. I'd like to say thanks to Travis on our team.
Emily.
Sorry, Jamuna.
I just want, I mean, at the end, I just want to thank you for this opportunity as well, because we could, you know, meet these wonderful people. Even though this is late, but you feel so good to see everyone. And because of GoPhil support, we, you know, we are able to rescue so many children and keep them safe and, you know, provide them their childhood back. And yeah, so we definitely need support, continuous support from you. And we definitely do more rescue, because I have already mentioned that there will be more children coming and to city for work, and there will be, I definitely would say that there will be disaster situation in our country in terms of trafficking. So we are ready to do rescue even in this emergency situation, because we are already in touch with different organizations and government people, working closely with government people and then stakeholders. And we are really concerned about the children's, you know, health and their development. So yeah, this is really great that GoPhil is really helping us. Thank you very much.
Thank you, Jamuna. I mean, I think that's what's great about these calls is I think it motivates all of us to feel connected in this way, and to be able to connect in this way, especially kind of at a time when we're all stuck inside our homes.
Yeah.
You know, it feels, it really does feel like you know, GoPhil is a global community, and it does feel that, you know, that we might be stuck inside our houses right now and looking at a long period of very limited or no travel, but to be able to connect like this on Zoom, I think is, you know, that's one thing we can feel hugely grateful for. I mean, I think the other thing that always comes out of these calls for me is when we hear from the partners, every time I speak to you, there's different impacts that we haven't considered in terms of the crisis. Like, this is so far from just being a health crisis. There's obviously the economic impacts, and then, you know, as you say, Jamuna, like, you're expecting that trafficking will increase. Obviously, which is something that we hadn't really necessarily considered yet. But yet it makes total sense that once movement is allowed again, because families have been pushed further and further into poverty, they will be more vulnerable to traffickers and to trafficking. So I think that, you know, from our point of view, this is, you know, it's great to kind of keep having these calls. We will be doing more of them, so please keep a lookout for these upcoming calls. We will keep trying to go around the country, so like country by country, and inviting partners to join. So, you know, thank you so much to Travis, was the member of our team who originally came up with this idea for Zoom calls. So I just want to say a huge thank you to Travis for initiating it. And, you know, he does all the organising and legwork that's involved in pulling them together. So thank you so much. I know, like, as I've said, you know, this is an extremely difficult time for everybody, but if you are able to kind of spread the word and share details of our rapid response fund in your communities, with families, with friends. Travis, I think, has just shared the link. We have already sent out, I think, around 10 or 11 grants, and we have several more to go this week. So now it's quite exciting because we're starting to kind of capture the impact and the reach of these grants. So we'll be sharing that more with you over the coming weeks, like the you know, the incredible impact that our, you know, the support we've received has made. You know, what's really incredible is that, you know, every little really does help. Like, our partners often work really kind of on very tight budgets and can make every single dollar go very far. So please do feel that sort of any donation, like, you know, large or small, is very gratefully received. So yeah, thank you so much to everybody for joining, particularly those of you who joined us over your morning coffee very early in the morning. I hope you enjoyed it. Please feel free, if you do think of questions that you would like to have asked, or you have any feedback, please do feel free to share those and to send those across to us. And most importantly, just to wish everybody, like, I hope everybody stays safe and takes care of themselves at this very difficult time. I thought we would, I don't know how this would go, but we're going to try and switch cameras on so that we can at least wave goodbye to each other. So let's see if we can, you know, if you want to put your videos on. Oh, it's so nice to see everybody. It's quite strange because most of the call I'm just talking to a bunch of names in black and white on the screen. So it's really nice to be able to see everybody's faces and maybe to make that connection.
Maybe Jamuna can lead us all through a big Maya, something that everybody maybe explain for our goodbye.
Yeah. So we, in our care home, we teach Big Maya training. So Big Maya is a big law. Maya, love in Nepali Maya. So we always do like this, Big Maya, and then you have to receive like this. So let's do bye-bye in a way. So Lydia, Travis, and Emily, actually they know. So everybody, Big Maya.
Big Maya.
Bye.
Big Maya. So we have to receive like this. So Big Maya from us. Thank you so much.
Thank you all so much.
Thank you very much. Take care, everybody.